Hi class, this is part 3 of our discussion on the nervous system. We're going to focus on the peripheral nervous system and drug use in this discussion. The first discussion we had focused on an overview of the nervous system and action potentials or electrical signals. The second discussion we had focused on the central nervous system, and now we're on to part 3. So let's go ahead and dive in. Our peripheral nervous system, the PNS, is going to include anything outside of the brain and spinal cord. So we have the 12 cranial nerves and the 31 pairs, or the 12 pairs, I should say, of cranial nerves and the 31 pairs of spinal nerves, and then all of the ganglia and sensory receptors outside of our spinal cord and brain. Our spinal nerves are going to send information to and from the spinal cord, and cranial nerves send information to and from the brain directly. So if somebody's had damage to their spinal cord, they can still use all of their cranial nerves just fine. And this is one of the reasons why if somebody breaks their neck, breaks their back, their face still works just fine, because cranial nerves are typically associated with controlling the face and digestive functions, where spinal nerves are associated with gross motor movements. The peripheral nervous system has two subdivisions, the somatic and the autonomic. The somatic division is going to carry information away from the central nervous system, so this is going to also be known as the motor division. The voluntary motor division, and then we also have the autonomic branch of the motor division, and this is going to involve involuntary responses. Not mentioned here, but worth notable is the fact that we also have the sensory division. The sensory division carries information to the spinal column, and then carrying information away, we have the motor division. And we have our somatic voluntary motor division and our autonomic involuntary motor division. Here we can see the structure of a generic nerve. So this could be a spinal nerve, a cranial nerve, it doesn't matter. We find that in a nerve, we have a structure or a hierarchy similar to a skeletal muscle. So we'll have a bundle of bundles, and then individual fibers within the bundles. The individual fiber that in a nerve, an individual nerve fiber, is an axon of an individual neuron. And this is a common misconception. Students commonly assume neurons are nerves. Neurons are a cell type that contain axons. A nerve is a bundle of different axons from different neurons. If we look at our cranial nerves, they're typically numbered from front to back and then lateral to medial. So let's go over our nerves. We have cranial nerve 1, the olfactory nerve, cranial nerve 2, the optic nerve, cranial nerve number 3, that helps to move our eyes, cranial nerve number 4, which aids us with eye movement as well. Then we have cranial nerve number 5. This is going to control our jaw and mouth muscles, and because of its 3 branches, it's called the trigeminal nerve. We have cranial nerve number 6, which controls our eye muscles. Cranial nerve number 7, which is going to control our tongue and some of our facial muscles. Cranial nerve 8 is going to come from the inner ear. It's called the glossopharyngeal nerve, and it conveys our sense of sound and also our sense of orientation in our bodies. Cranial nerve number 9 is going to help us with swallowing. Cranial nerve number 10 is the vagus nerve, and that aids us with digestion of our internal organs. Cranial nerve 11 helps us to move our neck and upper back, and then cranial nerve 12 aids us with moving the tongue. For your lecture exam, yes, you do need to know what the cranial nerves are associated with. You also need to have these memorized for your lab exam as well. If we look at the somatic division, this is going to serve the skin, skeletal muscles, and tendons. This somatic division is part of the peripheral nervous system, and we'll even have some automatic responses. These automatic responses are known as reflexes. Reflexes are going to involve both the peripheral and central nervous system. It'll involve information going into the spinal cord through the dorsal root of the spinal nerve, and then there'll be an interneuron that processes the information in the spinal column, and then will send the information directly to a motor neuron, which leads through the ventral root or anterior root of the spinal nerve to go to the muscle. So let's say you put your hand on a hot stove burner, you feel the sensation of burning, or let's say you're getting stabbed by a pin. That pain travels to the spinal column. The spinal cord goes, wow, we need to intervene right away with a reflex arc. And then we'll send a response to the motor neuron to pull your hand away so you don't stab yourself with a pin. Within the autonomic division of the peripheral nervous system, we're going to have involuntary muscles be regulated and glands. So we'll have smooth muscles and cardiac muscles being regulated. The two main divisions of the autonomic nervous system are the sympathetic and parasympathetic divisions. Our sympathetic division helps us to handle high stress situations or the fight or flight responses. So it'll speed up our metabolism, speed up our heart rate, raise blood pressure, increase cardiac output, make our breathing speed up, and slows down digestive functions. On the other hand, if we are in a situation where we need to recover and repair and heal, we need to activate our parasympathetic nervous system. It's going to be the rest and digest division. So it slows down the heart rate. It is going to return our body functions back to normal and increases blood flow to the digestive tract. One of the primary reasons why you feel sleepy after eating a big meal is because the parasympathetic branch of the autonomic nervous system is diverting extra blood to the digestive tract, and you have less blood going to your brain. So the PNS and CNS work opposite of each other. We find that the sympathetic nervous system is going to be regulated primarily by spinal nerves, and that the peripheral nervous system has most of its regulation from the vagus nerve, or cranial nerve number 10. So, class, concept check. Which cranial nerve innervates many of the organs of the abdominal pelvic cavity? Is it cranial nerve 1, CN2, CN10, or CN11? Go ahead and rewind the video to get me an answer, or check your notes. 5, 4, 3, 2, 1. The correct answer is C. The vagus nerve will innervate many of the organs of the abdominal pelvic cavity and give parasympathetic innervation to those nerves and body systems.